Hey, hey, we are live. Hey, hey, hey. Good morning. Good morning, morning. Welcome to my channel. It's another day. Time to get this started. It's another day. Another 5K walk. It's another Sunday. And today, this is the 30th, isn't it? 30th of May, I think. Yeah. We are here again. Oh, another awesome time. Walking together, exercising, strengthening our body, our muscles, trying to lose weight, trying to keep fit. And I have to say, thank you so much for joining. Thank you. You're going to watch the video later. Thank you for watching. And if you haven't subscribed to my channel, please do. Please. I really need the subscription, the likes, the comments, just to make my channel grow. So please subscribe, help me grow, help Divinely Classic grow, be part of the brand. You can say, oh, I know when that channel was like really young, but look at them now. So please join the success story of Divinely Classic and you'll be pleased, you will. Anyway, thank you so much for joining once again. Just decided to go for this walk, which we always do. This is a hill, so pardon the way I'm breathing, which we always do every Sunday morning. I have to say, I really like it because, you know, when I woke up like 5:30, I'm like, oh my God, do I really have to go? But yes, I have to, because I had already committed myself to doing this every Sunday. And, you know, I'll say I had just one opportunity to exercise all through this week. So this is a good one. I didn't have the time. I think I only exercised 4K on Wednesday or Thursday, you know, so doing this, committing myself to this is super helpful to me. So I don't know about you, you know, you need to commit. The time might not suit you, fair enough, but go for your walk when the time suits you and, you know, help your body, help the doctors, and if you're in UK, help the NHS, because this is a good way to you know, do your own part in managing your health. Like we've been discussing all through the previous walks, you know, healthy lifestyle, the good management technique for a variety of illness. When you're talking about high blood pressure, healthy lifestyle is your go-to, you know, in terms of self-management now, is a good one, as well as your meds anyway, depending on which advice you were given by your doctor, okay? Talking about type 2 diabetes, you know, same, healthy lifestyle is your best bet as well, you know, and today we're going to talk about stress. Last week, talked about calories, and it was how calories affect your weight gain, your weight loss, your overall well-being, you know. These exercises that we're doing, weight loss and all that, calories the foundation. If you understand how calorie works, you know, you're good to go, you know. And just a quick one on the side. I did a video or a post on Facebook about my meal, my dinner. And I'm a Nigerian, yeah, and my meals are predominantly Nigerian meals, So there's this falsehood, I'll call it, that Nigerian meals make you fat, that when you're on a weight loss, you shouldn't eat our meals and stuff like that. That's a big lie. That's a big lie because it depends on your knowledge of your calories and how you're able to manage your portion control. I had fufu, Nigerian fufu, cassava fufu. Was it Thursday or Friday? And I had it with peanut soup. For people that are calorie conscious, you should know how much calories you have in your peanut soup. And if you don't know, 10 seeds of some peanuts is actually 60 calories. So you can imagine how much I used to make my meal, my soup. It was a lot, I'll be honest, but because I know what I'm putting in my plate, I know how much calories are there, I was able to manage. I still enjoyed my meal. I had my fufu, I had my peanut soup, had it with fish. And overall, my calorie was about 800 and something, 900 and something calories, for which I was happy for. My fufu size was pretty decent, I'll say. Well, average, I'll say 200 grams of fufu. Yeah, and another way to check your calories is MyFitnessPal. There are other ones anyway, other apps, but that's what I mostly use. MyFitnessPal is what I mostly use to get my calories in there. So yeah, just know your calories. If you haven't seen the video, I've got 2 videos now on calories. There's a 7-minute video that I did sometime last year, just going down to the nitty-gritty of calories. And then the one I did last week was just on the walk like this, talking about calories, yeah? So, yeah, that is it for our calorie talk. Anyway, today, that's why I was a bit late. I apologize. I meant to start 6 o'clock, but I started 6 past 6 or 5 past 6. Today, I'm going to talk about stress. Stress, yeah. STRESS. Stress. And what does stress mean? We use stress as a word every day. Oh my God, I'm so stressed. Oh my God, this thing is doing my head in. Oh my God, I can't take this anymore. So these are all evidence of stress, when you're kind of feeling challenged, when you're feeling overwhelmed, it's just, it's normal, I'll start with that. It's normal for you to be stressed. We're all humans, and that's how our body was programmed, for us to have this stress coming every now and then. But the problem is when you are consistently in that stressful situation, and that's what we're going to talk about today. What happens to your body, and how to manage it and all that, yeah? That's what we're going to talk about today. So I'll start by defining what stress is. My apologies if I'm talking really fast. That's because of how I'm walking. Yeah, I'm going to start with what stress is. So what is stress? Stress, because I had to make notes, sorry. I can't say everything from the top of my head. So stress is a natural response to a real or perceived danger. I'll read it again. Stress is our body's natural response to a real or perceived danger. And stress could also be a feeling of not being able to cope with specific demands or events. And these demands could be, oh, I've got 1 kilometer, yay. Let me walk fast. I want my pace to be great. Come on, we're going. I'm just waiting for you to talk, like the kilometers, and then We'll carry on. Yeah. So I got 1 kilometer. So the demands and the events that we're talking about, they could be day-to-day living. It could be day-to-day living, some people are so stressed. They find it difficult or hard to just carry out a daily task, like waking up in the morning, even preparing their own meals and stuff like that. Holding a job down, stress could cost us. And, these are demands, daily demands and stuff like that. And the event could be like when you have something upcoming, say you're planning a wedding, you've got funeral, God forbid, you've got job interview, you've got, something really big that you're looking forward to. This could induce stress as well. It's, and it's normal. Don't be scared. It's a normal reaction to events or challenge. That's our body's way of responding. So, and these demands, like we said, could be work, could be relationship, could be financial pressure, could be anything at all. Like this walking that I'm walking now, a stressful situation, but the good thing is it's a good stress. Yeah, it's a good stress. This was called eustress. So it's EUSTRESS. That's eustress. That's a good stress. So this I'm doing now is good for my body. It's a good stress. And there's another one, so called distress, which a lot of people are familiar with. Oh, she's distressed. She's really upset. Those are all signs of being distressed. So this stress is, well, I won't say bad stress now, but you know what I mean. It's the other way from good stress. That was called eustress, so that's called eustress. So distress is kind of the negative side of stress. The positive side is eustress, and that's a motivator, because stress could be motivating. Like when you have an exam coming up, that's an event. That's something that could be challenging. Your body kicks into that stressful mode, so that's a good stress. And research has shown that when we are stressed, our brain, there's what's called increased perfusion to our brain. They're a lot, but we're going to talk about that in depth as we go on. So this stress is a demotivator. It's really, it just knocks you out. Stressed, you see them not in a good state. They're not kind of up to stuff. So you need to encourage yourself, encourage them, and come on, we can do this. Yes, it's stress. We know, but we need to look at the bright side of it. We need to look at how we can make the good come out from this. And when you are stressed, our body, you remember the response we're talking about. What happens there is your body goes into what is called a fight or flight mode. So fight or flight mechanism kicks in, and it tells the person when and how they need to fight or run. For example, I remember the analogy given to us years ago about if you see a lion coming towards you, two things. You're going to say, should I just wait and let this lion have its feed day? Obviously, that's rare in the UK, like just in the lion on the street and anywhere in the world, really. But you're going to think, should I just wait and let this lion just, have his feed day? This is it for me. And you start saying your last prayers. Or you're going to go, right, I need to dash off. I need to run. I'm not going to, at least let me give him a little fight. So it's fight or flight mode. Your body's going to kick in. And what happens is that you become kind of prepared. Your body is telling your body, you get my point. You do this, you go there. Messages are sent to the brain. The brain is responding by sending messages all around the body. We need more blood in the muscles because this person needs to run. We need more blood pressure. So there's increased blood pressure, so it's just about your body's way, really. When the fight or flight, oh God, this is a hill. Oh, these hills are hard. They're really hard, sorry. Oh my God, it's really hilly, if you can say. And it just makes it more difficult, but it's good, keeps the calorie burning even more. Yeah, so apologies for that. So this fight or flight mechanism is very good. But then if our body gets accustomed to it, like all the time, we are easily triggered, then that is not good. It will cause serious damage to our mental and physical health. And that is what we really don't want. That's the point of this topic today. That's why we should, oh my God, I need to rest, sorry. My workout is gonna pause now. I know. My workout has paused. Yeah. My heart is pounding so fast. So actually my body is in a fight or flight mode right now because it's stressed. My body's stressed as we speak because I've decided to go on this long and sometimes hilly walk. So my body's responding, my heart is pounding, my muscles are stronger. I think I'm alert. I hope so. Yeah. Okay, so we carry on. Thank you for your patience. So when stressed, our bodies, my workout has resumed. When stressed, our bodies are flooded with hormones that prepare to evade or confront the danger. Like we said earlier, large quantity of these hormones, they are cortisol, that's what's called stress hormone, cortisol, epinephrine, norepinephrine, and these are the hormones that, our body secrete in response to a stressful situation. And yes, they can be good. They can be good to like deal with that thing there and then. But in large quantities, that's where the trouble is. That's where it starts to have, or rather, it starts to have a negative effect on your body, which we really don't want. So what does these hormones do when they're secreted? Yeah, that's my shadow. It's my shadow. Yeah. So these hormones, when secreted in large quantities, they trigger the increase of your blood pressure. Oh my God, there's a dog. The dog decides to attack me now. My fight response is gonna be. Let me cut the other way. I was even a small dog. Yeah. So there's an increase in blood pressure. That's because your body is getting ready to run or even fight. And then there's muscle preparedness. Your muscles are going to get stronger, like they might even be itchy or twitching because there's more blood flow going to that area. The body knows that, okay, I need to send blood to the legs because they're going to run if that's the option of this person. So there's more blood flow to the leg muscles, especially. And then you see yourself sweating. Have you ever been in a really, really difficult situation that even if it's the weather is super cold, you are hot inside, you're sweating? That's because your body is working really fast inside. Your organs are going really fast, sending messages to and fro, trying to make you respond to that situation. And then there's increased alertness. When these, remember we're talking about how your body responds now to stress. We said your body secretes cortisol, epinephrine, and non-epinephrine. And these are also called adrenaline and non-adrenaline. Okay. I stand to be corrected, but I think America uses epinephrine and non-epinephrine, and we use adrenaline and non-adrenaline in the UK. So please, if I'm wrong, kindly correct me if you got better explanation. Okay, so then we've got increased alertness, more blood flow to the brain. There's what's called vasodilation. Your vessels are expanding, your blood vessels, because it needs more fuel. And what's that fuel at that time is blood flow in order to energize every part of your body that needs to fight or flight. And then increase heart rate. Like when I was walking now, when I was going through those hills, I had really increased heart rate. My heart is pounding really fast. Oh, 2 kilometers, yay, that's good. 2.99 kilometers. I'm just waiting for it to finish talking. 6.9 kilometers. Okay. I'm not going fast enough. I wish I was. At the point, I'm going to run. Okay, so finish talking. So there's increased heart rate as well. And there's a term called stressors. And what are stressors? Stressors are those environmental factors that cause stress. Like what I said earlier, this walking is a stressor, but it's a good stress. So it's use stress. Like you got a wedding coming up, it's a stressor. You've got an exam coming up, it's a stressor. You've got financial is a stressor. So a stressor could be anything. It could be anything that could trigger stress. Anything at all could trigger stress is called a stressor. And what are the physical effects of stress? Like we said earlier, increased blood pressure, increased heart rate, increased respiratory rate. See how fast, if I was to check my respiratory rate now, the normal parameters for adults is 12 to 20 beats per minute. Yeah. Respiratory beat per minute, or respiratory rate, yeah, per minute, 12 to 20, within there. But at this rate, if I was to check mine, or even if I decide to run now, mine is going to be like 25, maybe 30. That's because it's my body's just trying to respond, trying to increase my oxygen intake, because I am using oxygen right now. I am using more than normal. So my body's trying to increase, it's sending messages to the brain. The brain is sending messages to the lungs to increase the rate and the depth of my breathing. And my muscles in my lungs are going, So these are, like the physiological explanation of the effects of stress. I just try to break respiratory rates down, why your respiratory rate is going to be increased. So, yeah. And then when you're stressed, physical effects of stress is digestive, a decrease in your digestive function, a decrease. The muscles in your digestive system is just going to relax, because, right now we are, your body's got other things to do with its blood flow. So there will be less blood flow to that area. So there's a decrease in digestive system. There's a decrease in immune activity. That's very important, because that's why they keep saying, try not to be stressed, not to be in a stressful situation all the time, because it's going to affect your immune system. And what happens is that you have a decreased immune ability, thereby leaving your body open to infection and all that. And that's primarily a cause of cortisol. What cortisol does is that it just inhibits It inhibits immune cells or hormones from responding. It just blocks them. And another thing that cortisol do, which is the key stress hormone. Cortisol is the key stress hormone. Another thing that it does is it inhibits your body's ability to take glucose, temporarily though. It just shuts off that cell reuptake of glucose, thereby increasing your blood glucose. But what it's actually trying to do is make you have enough energy to face that challenge, that stressful situation. So cortisol does that. But remember, the problem is we don't want to be in that state too long. Imagine if you had to be in a state of this increased heart rate, increased respiratory rate, increased blood pressure. Trust me, sooner or later, that person is going to have severe cardiac issues, severe respiratory issues, severe renal issues, your kidney. Because all this, physiologically, your kidneys are at work as well. It's your kidney that is sending messages trying to increase your reuptake of fluid so that your blood pressure is increased. So we don't want our body. Halfway point reached. That's great. So I've got 2.5 now. That's great. So we don't want our body in that prolonged state because we're not doing ourselves any good at all. And then there's a heightened state of alertness. Like we said earlier, remember, these are the physical effects of stress. And then there's sleep problem. Some people can't sleep. And then when you ask them why, they say, "Oh, I just can't close my eyes. My head is just so active. My brain just keep going haywire. I can't seem to just shut it down." These are stress related. These are stress related. If you decide to do kind of an in-depth interview, you realize that there's something that, they're worried about. There's something that, that's keeping them awake. So when we're stressed, trust me, you're going to have sleep problem. When you have something really, really stressful that you're worried about, you have difficulty in sleeping. You might sleep, but then it won't be a good sleep. It won't be deep to kind of have any physical benefit for your body because, as you know, we sleep just rejuvenate our body, our brain, our organs, so sleep is essential, and stress can deprive you of good sleep. We don't want that. So there are types of different types of stress. Yeah. There's acute stress. Acute stress, when you hear the term acute is short term. Something that's just really rapid, is just come. It's not, being prolonged. Say, when I decide to start working this morning, now that's an acute form of stress that I've just put my body in. Okay, so whatever response my body decides to give is, is due to the acute stress. So it's going to be really short, really rapid. And then when I have stopped exercising, when I get home now, I take my bath, my body's going to return to its normal state. Okay, so acute stress is a short stress, it's not prolonged. And the kind of symptoms you get with that is headache, headache, you might get upset tummy and stuff like that. But acute stress is not really damaging. Acute stress is part of our day-to-day life. How many times when you kind of maybe doing something, go, "Oh my God, I've got headache." Yeah. But then when you off that thing, you're not doing it anymore, you're fine. So that was an acute state of stress your body was in. And then we have a chronic stress. That's the bad one. That's the big one. That's what we should be careful about. That's what we should avoid. And that chronic state of stress is that prolonged state. Remember, all these we'll be talking about. Imagine if you have to be in that state for long. If you have to always, is the car coming? I'll just wait. Yep. if you have to, be in that, no, this place is nice. It's a new place. If your body has to be in that state for a long time, the effects will be harmful, increase the risk of cardiovascular issues, increase the risk of respiratory issues. You're going to get sleep apnea, like we said earlier, increase the risk of lack of immune, your immune system is going to be reduced. Really, immune function, I'm trying to think of a good word to say. Immune function is going to reduce. So overall, can I go now? Yep. Overall, you're harming your body. And then reproductive state is going to be affected as well, your reproductive state. So, if you know anybody who is TTC, trying to conceive, you tend to advise them, after doing the other test anyway, try to relax. I know it's hard, waiting for a baby, but, stress is going to make it even worse. When you're stressed, it's going to be really, more difficult really to conceive. So because stress affects our reproductive system, it just decreases the ability to. And then effects of chronic stress, remember, that's what we're talking about now. Type 2 diabetes. Remember when I said it earlier, that cortisol inhibits glucose reuptake. Yay, I got 3 kilometers. Yay. Yeah. I'm happy. Please hold on. It's just talking about my speed and stuff like that. Yay. I can turn back now and go home. What happened? Yeah. I'm not sure. We got somebody here. Oh, we have? What's that? Okay. Oh, hello. Morning, lovely. I've just seen you. How are you?
Very good.
Yeah. How long have you been here? I didn't even notice.
Not too long, to be honest.
Okay. That's fine. I just got 3 kilometers now. So I was talking about stress. Yeah. I'll turn back home now. Let me go home. Let me start going back home. So I'm going to get 6 kilometers now when I get home. So I was talking about stress. So I don't know if you heard anything about my stress topic. Did you?
Not much. None of the joints.
Okay, that's fine. Said a lot about stress, the types of stress, its effect on our body. So I'm talking about the different types of stress now. There's acute stress and there's chronic stress. And we don't want to be in that chronic state. The acute state is a norm. Even as I'm walking now, my body is in acute stress state. But the chronic state, like I said earlier, risk of cardiovascular issues, risk of respiratory issues, sleep apnea, decreased immune activity, decreased reproductive activity or ability, type 2 diabetes. Stress can cause that because that's what I was just saying, that cortisol inhibits reuptake of glucose. So that's circulating glucose in our bloodstream, is going to cause, if prolonged, if that cortisol is constantly secreted, we have higher amounts of it, it's going to cause more inhibition and then increased blood glucose, and that can lead to type 2 diabetes. So stress, chronic stress now is harmful. It's harmful to us. And then chronic stress can also cause, we said that earlier, increased blood pressure. We talked about increased blood pressure the other day. After a while, it's going to lead to hypertension. If it's prolonged, it can cause depression. Chronic stress is the major cause of depression, or is one of the causes of depression. Depression is obviously a mental and a psychological illness, but stress is a key factor is a key player in depression. And then anxiety, chronic stress can cause anxiety. People are always anxious. That's because their body is in a heightened state of stress. And then PTSD, stress can cause it. PTSD is post-traumatic stress disorder. And these are, kind of serious psychological or mental illnesses, if you like. It's more psychological. And poverty can cause it, or it can, no, it can't cause it, poverty. I don't know if poverty can cause stress, though. I don't know. But, you can think about, I don't have money, and you'll be stressed. So, okay, yeah, the causes now of stress. I was talking about the types, acute, chronic, and, what they can do to your body. So the causes of stress, job issues. That's where I got poverty from. Job issues, poverty, lack of time, when you haven't got enough time to do everything you want to do, you become really stressed. And then bereavement, when people lose someone, they are in that state of bereavement, they are stressed. That's why, God forbid you lose someone, people encourage you. It's not like they say, don't think about it, but they're just trying to tell you, don't harm your body. Don't be in that state for a long time because it's got negative impact on your body. And then what are the symptoms of stress? Oh God, when you're going back now, we heal. Some side are healing, some side are all right. So the symptoms of stress, I said it earlier, sweating. When you are in that challenging situation, you realize that you're sweating, even if it's cold. And then pain in the chest. And the other day I did say that if you know somebody who is always complaining of chest pain, it's a really serious issue, please go to A&E and, just do some check, just to kind of rule out the possibility of a cardiovascular issue or an attack. There could be heart attack that are kind of not much, just a small one. They say somebody had a small heart attack. Sometimes these things just happen. Oh, my chest. It could be an heart attack. So it's best to go to the A&E and they'll do whatever test, ECG, whatever they need to do. And remember how we talked about, I'm going to stop in that bus stop and pause. I'm tired. Just here. Oh my God. Just give me a minute. Let me go to that bus stop and sit a while. Oh God, I'm going to sit here. Lordy. Oh my goodness. Oh, my workout is going to pause now. I know. So the causes or the symptoms of stress, sweating, pain in the chest or back, cramp. Sometimes when you're feeling stressed, you do get cramps around your body. And then there's muscle spasm, and then fainting. People faint when they're in shock, when they're in stress. And then headache. Headache is a symptom of stress. Chronic headache is an indicator of chronic stress. Chronic headache is an indicator of chronic stress. So these are things that should be checked out. And then when we are stressed, the way we react now, emotional reaction is anger. Some people, you see them, they're always angry. It's that state of heightened stress that they've subjected their body to. That's why they are angry all the time. It's just a reaction of stress. So sometimes when people lash out at you, it's not you, it's them. When people lash out at you all the time, trust me, it's not you, it's them. They're having serious issues. They're having lack of self-control, serious stress issues. And then when you're patient enough to talk to them and say, okay, what just happened? That wasn't me. Do you want to talk about it? And then if they decide to open up, you realize that, yeah, it wasn't me really. They have a lot of issues going on, and you hear them, they might start to tell you the story of their lives. So anger is an emotional reaction to stress. And then there's burnout as well. People are, tired after working for a long time, they're stressed, you see them burn out. They can't do anymore. There's what's called fatigued. I've talked about that. It's one of the emotional reaction as well. You're just tired. You can't even be bothered to do anything. You're burnout, really. So that's an emotional reaction to stress. Okay, I've got my breath. Let me keep walking. So, and then lack of concentration. Yeah, my workout has resumed. Lack of concentration. People can't concentrate on stuff. That's because they're stressed. Sometimes you want to even read. You've got an exam coming up. You can't. You're looking at the book, but it's just not registering in your head because you're thinking about this stuff. Oh my God, have I made dinner? What are my kids going to have for dinner? I need to make these sales, blah, blah, blah. There's no way you can concentrate. And then fatigue is an emotional reaction as well. And then forgetfulness. People forget themselves when they're stressed. And related behavior of stress. It's food craving. You see some people, they say they're eating. How do they say it again? They say they eat emotional eating. Yeah. So, oh God, emotional eating. And they eat and, just eat abnormally. It's a sign of stress when you can't control what you're eating. That's a sign of stress. And then angry outburst. Like we said earlier, these are related behavior of stress. Drug and alcohol misuse. That's a key area. Because some people, when they're stressed, they can't control it. They think drug and alcohol will help them, and they tend to indulge in this behavior and they misuse them. And then frequent crying. Some people are very, very emotional. When they're stressed, the next thing they're crying. It's a behavior of stress, and then anxiety, and then depression. These are all related behaviors of stress, and we don't want to be in that state for long. So what are the diagnoses of stress? If it's just the normal stress, normal day-to-day life, that's not a big problem, that's a norm. But then when that stress is chronic and is affecting your way or your ability of just performing the day-to-day task. You're in your house crying all the time. You don't want to see anybody. You're very emotional. You're angry. You just lost the will to live. These are, and possibly depression. You need to go to the doctor. You need to have a comprehensive, stress-oriented, face-to-face interview. You need it so that the formal diagnosis of stress would be made, and then you can have appropriate treatment and management, And there's this, if you check statistics now, I think more women are diagnosed with stress than men. That's because of kind of societal pressures, if you like. Men don't like to talk about stuff, don't like to talk about emotions. Women are more likely to cry. Women are more likely to seek for, medical help. But men want to be a man, bless, but it's good if you think you need help, do not man it. Do not man it, go for help, speak to a doctor, speak to a psychologist, whoever is going to help you and get treated. Start to take whatever medication, whatever management advice they give, because it's for your own good. So what are the treatment options? There's self-help, which is, what we are doing. Oh, I've got 4 kilometers. I'm just waiting for you to talk. 4 kilometers. Yay. Hour. That's actually a good one. I like that thing. Yes, finish talking. So the self-help, which is what we're doing now. It is exercise, relaxation technique. And if you've noticed, when you're stressed, go for a walk. I'm talking about acute stress now. When you're stressed, go for a walk. Just get the fresh air in. Come back home, take a bath, and you see how relaxed you are. You can even sleep better. Some people exercise in the evening because it makes them sleep. I remember when I used to exercise in the evening, after 10 minutes in bed, I'm fast asleep. I'm knocked out. So stress can be managed with exercise and self-help. And then there are relaxation techniques, therapies that you can, be prescribed to or referred to do. And then the medication, there are some antidepressants. If the doctor is saying that, okay, this person would need more than just self-help, exercise, therapy, and all that, they might prescribe antidepressants for the person. And there is another ways that we could manage it is exercise, like I said earlier, then reduce alcohol intake. Alcohol, drugs, these are, they are depressants on their own. They are depressants, but people think they are antidepressants. No, they're not. They are depressants, because they're going to put your body in that stressful state as well. So why take them, especially when you can abusing them now? Anyway, we move on. Another management strategy is healthy living, what we're doing, the walking, the nutrition, making your diet healthy, priority management, that's very essential. Prioritize. I was having a discussion with somebody yesterday about how much I have to do. And we said the same word, priority. Look for the ones that are pressing. I've forgotten how she said it now, but what you need to do now, do now. What you can keep for later, just arrange them in order of priority and go for the ones that are more pressing, that needs urgent attention. Do those ones, and then you follow suit. So priority management is a key management of stress. Then time, have time for yourself. This, my Sunday morning walks, it's my time. You know what they call me time? I love it. I don't worry about nothing. Don't worry about school. Don't worry about cooking. Don't worry about trying to make money. No, it's my time. It's for my health. So try to make time out for yourself. You might be accused of being selfish. No, you will not. Your health is important. It's even more important because when you're ill, you can't do anything. You can't be a wife, you can't be a husband, you can't be a mom, you can't be a student or whatever. And something I shared on my Facebook page the other day, You know, living healthy is expensive, but healed earth is more expensive. It's even more expensive. So let's take that time out for ourselves to just relax. Do your stuff. Do what you want to do. Do you. It's good for your mental health. It's good to reduce or manage stress levels. And then breathing. You know, when you're stressed, they say, okay, take a breath. You know, sometimes, if you go on YouTube, there are lots of breathing exercise to reduce stress. You know, you take a breath, hold it in, slowly exhale. They're therapeutic, these breathing exercise. So if you think that's what will work for you, there are lots of video on YouTube. You can use them to de-stress. And then talking to somebody. If you feel overwhelmed, talk to somebody. But then check that person is not CNN International, where they'll broadcast your news everywhere. But just like, look at this person. Do I trust this person? Can I open up to this person? Talk to somebody. It could be a family member. It could be a friend. It could be anybody that you trust. But just know that this person is trustworthy. No man is an island. We all need each other. We need a relationship. But it's up to you to be wise and make the right relationship. People you can talk to, people you can trust. They can help you if you're feeling stressed. And then acknowledging the signs. That's the last one now. Acknowledge the signs. Remember what we said earlier, that chronic state of headache, chest pain, increased rest rate, increased blood pressure, just when you know that's how, you know that you're stressed, acknowledge it, seek for help, and just follow your doctor's advice. Stress, I'll just conclude by saying that, stress is our body's natural response to a perceived or real threat. And that perceived or real is, sometimes we stress about things that are not there. You say, oh my God, sometimes one thing, we can build it in our head to become 100. Say, oh, this person, oh, this happened. Oh, is it because of this? Oh, was it because of the, we'll just be, building theories in our head. And sometimes it's not even real. It's not even there, So that's why they said, could be a response to real. The danger might be real, you can see it, but then there might be no danger. You're just making stuff up in your head. So that's the definition of stress. There are different types of stress. There's eustress, which is good stress. Like this, my work is a good stress for me. If I have a wedding to plan, it's a good stress, So, but this stress is those stress that's going to cost you, distress really, and it's going to make you bad stress. Distress is bad stress. So we don't want to be in that state of distress for a long time, like funeral, some other stuff, negative stressors, they're all distress. And then we talked about acute and chronic stress. Acute is the short stress, the one we see day to day. The chronic is when it carries on and it's hindering your ability to perform normal daily tasks. And then we talked about the management, the diagnosis, go to your doctor, seek help, management, your medication, therapy, talking to somebody, self-help, diet, healthy living and everything, prioritizing. So in a nutshell, stress can be managed if you seek help quickly or ASAP. And hopefully I've been able to talk to you. You've enjoyed or taken one thing or two from my stress topic today. And I hope I haven't made you even more stressed talking about stress. Yeah. At the end. And I'm almost on my 5K work. Yeah, any question, my sister?
No.
Did you enjoy the topic?
Yeah, I did. I think it's actually a very important topic that people don't take as seriously as they should.
Yeah,
Yeah.
yeah. Stress is because it can trigger different things.
Exactly. Very serious things.
Yeah, it can trigger different things. It could be good, it could be bad. And cortisol, I forgot to mention, I think I said it earlier, cortisol is the key stress hormone.
Yeah.
And then there's epinephrine and epinephrine. These are what are responsible for increased heart rate and all that when we are stressed. So hopefully we'll try to understand stress and its effect on our body. And I'm just waiting for my Thingbulb to get to 5K. So it will soon be there. Honestly, don't want my videos to be too long. But then there's no way you can do 5K without it being long. That's the thing. This is a hill, and I'm almost home now. I'm almost home. And when I stop, I'm going to run the last leg. Yeah, I've got my 5K. Keep complete. I'm going to end this video now because of YouTube, okay?
Okay.
I will call you back if you want to. I just need to end it. I don't want it to be too long. I might call you back, okay? Thank you very much, YouTube, for watching, for joining me on this day. Hope to see you next week, 6 to 7 p.m. every Sunday. Join us on the walk. It's good for your heart, good for your muscles. It's a good stress buster, good stress relief like we talked about today. And I'll see you next week. Please keep sharing my videos. Please like my videos. Take care. Bye-bye.